Hi there, this is Dr. Nathan DeLorey. Today we're going to talk about some of the misconceptions about chiropractic. I've been a chiropractor for over 25 years, and in our clinic we have a very methodical and scientific process. And I think that's a key because a lot of times when people think about chiropractic, they're not really sure what is chiropractic. I get a activator adjustment. Do I get somebody using a bigger hands-on adjustment? And so what chiropractic is varies. It's said to be, said that there's over 200 different techniques of chiropractic care. So I want to talk about some misconceptions about chiropractic care to help you understand more of what I believe the truth about chiropractic is. So let's jump into some common misconceptions about chiropractic care. First of all, a chiropractor is not a real doctor. Well, if you've ever heard this, we are not physicians, we're not a medical doctor, and so there is a difference in our training than a medical doctor's training. But what's interesting is the amount of credits that we had in chiropractic school is actually more than what it takes to become a physician, a medical doctor. So chiropractors do get real training, and I can guarantee that the state that you're in, and we're in Wisconsin, is not just handing out licenses. They're making sure that a doctor, somebody like a chiropractor that's claiming they're a doctor, is truthfully a doctor. So a chiropractor is a real doctor. Another conception that's talked about is that chiropractor is just cracking your back, that it's just some kind of crack. Well, this is a key thing to understand because it could be just cracking your back, or it could be a specific adjustment that's delivered in a very specific angle, specific direction, done after being methodical in our analysis of the body. So is it cracking or is it specific adjustment? Well, it all depends on kind of the intention. So when our patients come in, I'm not just going to ask you, for example, where's your pain, and then start throwing adjustments in there. We don't want to roll the dice with your health. We want to be accurate and specific with the care. We do something called the Gonstead system in our office. And what makes our technique or system of approach specific includes things like getting a thorough history, getting a thorough exam. And in the exam, we're going to be doing things like taking full spine x-rays, running temperature sensing device, or called a nervoscope on the spine, doing palpation. Each time I'm adjusting, I'm counting the vertebrae to make sure I'm on the exact bone that I think that I should be on. We've got the x-rays up in front of us. So all those different pieces allow us to be methodical and precise in the delivery of chiropractic care. So chiropractic care done properly is not just cracking your back. Another misconception is all I need to do is get out of pain. It's important to realize that we might think that way because that's how we've been raised. You know, when you go to the physician, they don't say, come back in 2 weeks no matter what. They say, what? They say, come back if you're still having that symptom. So we become very symptom oriented in this country. And so with chiropractic care, we want to think beyond just the symptom, but the cause of the symptom. And it's important to realize that healing can take time. It can take time not only to get out of that symptom, but to actually address what's been causing that issue. I've had patients come in for their very first visit and they're 76 years of age or even 80 years of age. Imagine how long their spine's been out of place. You might say, well, how long could it be out of place? Well, it could have been something at birth that caused their problems. It could have been something last week. So anywhere from birth trauma to last week, the problems could have started. So their problems could have taken decades to manifest. So healing does take time, and it's important to know that we want to not only get you out of pain, but address the underlying cause of the pain or other symptom. Another misconception is that chiropractors just want you to come back just for their convenience or their boat payment, what have you. And we do recommend maintenance care, but if you think about anything of value in your life, there's maintenance care required. You know, You might have made your bed today. You probably brushed your teeth. Maybe you had your oil changed recently on your car. All the different things that have value require maintenance because there's wear and tear on these different things. Our teeth have to be cleaned. Our hair has to be cut. Our body has to be washed. And what happens with our spines is that because of how we sit, how we lift, how we lay, how we sleep, how we play, all the different things of life requires maintenance care. So I started getting maintenance care when I was about 20 years of age. And I really wish I had been under maintenance care back in high school when I played soccer, and even before that as a 5th through 8th grader playing hockey. And looking back, I think about all those different injuries that I had, and I think I would have been a better athlete or more comfortable if I'd had proper maintenance care during those times. Now, if you're having to crack your back or neck every day to get comfortable, then you need to see a chiropractor. Now, I want to tell you a story about my own neck. I remember I was in my early 20s, went and visited my friend who was going to chiropractic school down in Iowa, and I remember I was cracking my neck. I was cracking that neck, and it felt good. Felt like it gave me some relief, some comfort. And I remember this chiropractic student, she said to me, you shouldn't do that. That's not a good idea. And I remember thinking, well, no one has ever told me that before. It felt good, it felt right, and what could go wrong, right? So what I learned from that experience and just talking to her was I needed to revisit what I was doing. I needed to think about what I was doing. And as I got more training as a chiropractor, what I learned was, if I was actually fixing this problem by cracking my own neck, why would I have to keep cracking it? Well, I wasn't fixing it. I was just mobilizing something. I was just moving some things around, and the bone that was actually out of place, the bone that we call subluxation, was a bone typically below where I was cracking that. So if you're having to crack your neck or crack your back, you've got a problem. Something's out of place. We recommend going to a good chiropractor, and we'd love to help you here at our office. So you might ask, what makes a good chiropractor? Somebody that's going to take the time to do a proper history, exam, take x-rays, put those x-rays up every time, run a temperature sensing device on the spine, that's how we do it, or have an analytical, reproducible way to know what's out of place and know if it's back in place. So in our technique, the Gonstead technique, we're running a nervoscope to check the spine. Other things that I think make a good chiropractor are somebody that's listening to what you're telling them. Somebody that's recommending care based on your needs, not their needs. So if you're doing better and you need less care, great. That's what we'd like to see. And it's having that honest communication, not just a rigid adherence to a plan that's just based on a financial incentive to that chiropractor. So a good chiropractor has integrity. A good chiropractor has honesty. A good chiropractor is listening. It's said that the best doctors are music majors. Why is that? What makes a music major a better doctor? They're listening. They know when to listen. They know when to play. And they've been conditioned on proper listening skills. So somebody that's a good listener will often hear when a patient says, I think my problem is this, and know, hey, maybe it is that. Maybe it is that specific cause that patient's telling them. So good listening is another part of being a good chiropractor. So today we've had a great opportunity to address some misconceptions about chiropractic care, which is so important to talk about. We've also talked about what makes a good chiropractor. And in our office, I seek to be a good chiropractor for those that come in. I want to be a good listener. I want to be methodical. I want to be precise. I want to be analytical. And I want to make sure that you get results and get results as quick as you can. If you have any questions, please feel free to leave those in the comments section below. Also, if you have any suggestions for future topics about hyperbaric oxygen therapy or chiropractic, you can leave those in the comments section below. To learn more about our clinic, see our website listed in our description below. As always, it's been a pleasure to talk to you. I look forward to talking to you on our next video. We're going to talk today about the 5 most important things a chiropractor can tell you if you've had an auto accident. The first thing to know is right away get your spine checked. Get to the chiropractor, have them check your spine. That means analyze what's in place, what's out of place, and as soon as you can, get adjusted. Secondly, get into a hyperbaric oxygen therapy chamber as soon as you can. A couple months ago I fell, I hurt my shoulder and really jacked my shoulder up. But within 1 hour I got into that chamber and wanted to get that relief, that pain relief, but also get the swelling down, get the inflammation down as soon as I can. So right away, take action, get your spine checked. Now for a lot of people, they might feel kind of okay. They might feel like, I'm really not doing that bad, but don't wait for pain to show up to know there's a problem. So again, no pain does not mean no problem. Now for a lot of people, we've been taught that don't go back to the doctor unless you have pain, but the problem is if you have a car accident and you do not address the problem, it could take months or even years for the problem to show up. Then you're on the hook for paying for that problem. I was in Alaska at age 19. I was walking in a truck. I heard the truck coming, and it was about midnight. They were coming out of a bar, and I thought they were just going to go around me, and they ended up hitting me. And they kept accelerating during the whole time that they hit me and drove away. I don't think they saw me. What happened next was I got flipped over. I landed on my butt and legs. I ended up being fortunate enough to walk away from this. But what was fascinating was about a month later, I met a chiropractor. He said, you should come see me. And I thought he just wanted my money. He just wanted me to come in and see him just for some kind of money thing. What I found out of now 2 months after that accident was I needed to see him. I had a lot of pain. In fact, I can still remember what the curtain looked like with the sun coming in from that curtain that morning when I woke up in so much pain, hoping to find that guy's number, hoping I could get in soon, hoping I could get relief. And by the next summer, this was like October when I saw him, by the next summer, I was telling him I was going to become a chiropractor because I saw so much relief, so much help. Now, some other things to realize is it might not be just you that was in that car accident. Maybe it was your child. And the thing to know about children and even teenagers is pain is not fully understood or comprehended by the body until age 18. Isn't that amazing? So when I think back to when I was a teenager, a young teenager, 13 and 12 and 14, we'd play tackle football for hours. And it was full out. We were running full speed trying to tackle that guy. Now, would I do that now? Would I want to be tackled now? No way. I don't want pain. And in fact, what I realize is I feel pain now in a different way than I did then. I didn't really recognize the pain. Now with that in mind, what I see, having been a chiropractor for over 25 years, is a lot of times the parents think they understand what's going on for their child. They understand what their child's feeling. And as I do a history and as I examine the child, a lot of times the parents are surprised to find out their kids are feeling something or maybe they have a dysfunction that's different than they thought the child had. So they might be having stomach problems and they don't even realize it, or constipation, don't even realize the child's having those issues. Or they're having headaches at a frequency much more often than they even knew. A lot of times kids just don't know how to communicate well what they're feeling, how often they're feeling it, and you know, they just don't know how to explain what's going on for them. Don't assume your child's okay because they say they're okay. It's good to have their spines checked also after a car accident. Also, what speed of accident can cause an injury? Does it have to be high speed? Does it have to be moderate speed? Or can a low speed accident cause an injury? Well, in studies, even speeds of 5 to 8 miles an hour can cause big permanent injuries to the body. Why is that? Well, the vehicles are designed to withstand impacts of just even 5 miles an hour without showing damage to that vehicle. The problem is that force that comes into that vehicle gets shifted to that body, to that person. Now their neck's sore, their back's sore. And it isn't whiplash just affecting the neck, it even can affect the low back. So as we look at impact speeds, don't assume because it was a lower speed that there's no problem. If you were riding on a bicycle and you're hit by a train going 5 miles an hour, do you think that's just the same as if you're hit by another bicycle going 5 miles an hour? So what's the difference there? Well, now it's the forces involved with that train hitting that person. So speed is not as big of an issue as what's happened to that body. How's that body injured? How's that body doing? I've had many patients say to me, I wish I had addressed the issues I had after that car accident when I could get coverage from the accident. You know, you can't come back to that insurance company years later and say, I still want to get coverage. There's only a certain timeline that they're going to cover you. So even people that have had small injuries need to be checked by their chiropractor to see if they're having problems. When selecting a chiropractor, who do you select? Well, if it's me, I'm looking for somebody that's precise, somebody that's specific in their adjustments, and somebody that's methodical. I recommend somebody that does the Gonstead technique or Gonstead system. Now, can I speak for everybody that does that system? I can't, because people cut corners. People have different levels of ability to see things and different levels of what excellence is for them, or even if they want to have excellence. In our clinic, we do something called the Gonstead technique because what I found is it's a way to be precise, to be methodical, to be so specific in that adjustment. You know, you can't just be on a bone and hope it goes in the right place. You also have to be on the right bone and be adjusting it in the proper way. But also, there's times to adjust it and leave it alone. So there's all these different aspects of doing precise chiropractic. Now let me tell you about what B.J. Palmer said about chiropractic. He's a promoter of chiropractic. His father, D.D. Palmer, founded it. Now B.J. was promoting it. In fact, we believe he saved the profession. He said, chiropractic is specific or it is nothing. Now, how did he know that? In a period for 2 years, they would adjust every thoracic vertebrae and every lumbar vertebrae at every visit. That's 12 plus 5 vertebrae. That's 17 vertebrae. Imagine having 17 different adjustments in one visit. Well, what they found was they were hurting people. So BJ said, the only thing you're going to do is adjust the upper neck. That's all you can do. And he was making them stop hurting people and be specific, be methodical, be analytical. And so with that, they saved the profession, they were getting results, and they were making a difference for those people that were under their care. Let me tell you about a patient that came in yesterday. He was in 2 auto accidents in January of 2025. So this is about 13 months ago. Now, one accident, he's parked, somebody hits him at 36 miles an hour. Another accident the same month, he's parked or stopped on the road, both times stopped, and he's hit somebody going about 50 miles an hour. So he's had 2 major accidents in a short time. Now, fast forward to today, or yesterday when we met him, and when I checked him, his pain level has been about a 7 out of 10 pain. This guy's been in a lot of pain. He's had 60 adjustments since that time, but he's still at a 7 out of 10 pain. He's had all kinds of trigger point injections and epidurals, and he's just not doing that great. But I do a real thorough analysis, and in the x-ray we see he's got 4 lumbar instead of 5. And we find which bones are out of place. We found 5 different bones to be out of place. And one of the things that happened, or was amazing, was when he came in, he couldn't extend his right leg back very much. And I adjusted his right sacroiliac joint, gave him a specific adjustment, and it was amazing. He could bring that leg into that extension a lot better. So I think what's been happening for that patient is they've just been doing general kind of adjustments. Where you sore, let's throw an adjustment in there. Let's pop and pray. Is pop and pray, is that good enough? I don't think so. I don't want that. So let's not roll the dice. Let's be specific. Let's be accurate. Let's be methodical. And that's really how chiropractic is designed. My next point today is that don't settle with the insurance company too soon. And what I see happen over and over again is people get a little money dangled in front of them. Here's $2,000. And if you sign off, we'll give you this money and we'll cover some care and life will be good. But what's happening is people are doing this before they've actually fully resolved their issues. They don't know if they're going to be left with a permanent injury. They're just hoping they will. Now, why would an insurance company ask somebody to settle before their injuries are gone? Well, the reason is that the insurance company is covering their assets. They're covering their risks, okay? And the reason is they want you to go away. They don't want you to come back with a big bill or an attorney and say, hey, we've got some permanent issues from this injury. So do not settle too soon. That's a big thing. Get some advice. Talk to an attorney. Talk to your chiropractor. Talk to your insurance agent. But don't let those adjusters get you to just sign away your rights to get the proper coverage. Now, one great way to not even have to deal with the other insurance company is to have the proper coverage in the first place. There's something called medical payment. And in our state of Wisconsin, you can have zero medical payment coverage on all the people in the car. You could have 10, 15, 20,000. I recommend personally I'd have $10,000 or $15,000 of coverage because one visit to the hospital, you can run up a bill of $5,000 pretty quickly. Person needing MRIs or if there's some broken bones. So if you've got people in your vehicle, make sure everybody's covered properly. And what's great to know is this added coverage typically doesn't cost that much. So look at medical payment coverage for your vehicle today. What do you do if it's been a while since the accident and you've not yet reached pre-injury status? Well, what we need to do is a couple things. First of all, realize healing takes time. You know, this problem that you had, if it was a car accident, could have dealt with a lot of forces. And in fact, we had a guy that had a head-on accident. He's going 35 miles an hour. The other vehicle's going about 35 miles an hour. And it caused a disc issue in his mid-back. And what we saw is he'd get relief, he'd get help for a few days, but he wasn't getting lasting change. And what was going on for him in his case was, because of that disc issue, it was just going to take time. It's said that a disc issue can take 18 months to heal. So sometimes it's just going to take 18 months to heal. For some people, they're going to need some additional care. For example, hyperbaric oxygen therapy is a great way to help in that healing process. It's going to decrease swelling, decrease inflammation, and it's going to work well with that chiropractic care. Maybe it's getting additionally some massage therapy or physical therapy. So there's many different things to look at as you're healing the body. And if a person's having ongoing issues, don't give up, just look for that additional way to get help. Now, after being a chiropractor for 25 years, I've got one last bonus tip for you today. Now, for a lot of people, what they think about their problems is it's just going to go away. And you know what we find after living life is not all the problems just go away. And what I've found as a chiropractor is if you can address problems when they're a small problem, it's going to need a small fix. If you wait till it's a bigger problem, it's going to need a bigger fix, and sometimes maybe you can't even help that person. So if you have a problem, address it when it's small. Take action when it's small. Don't wait for that proverbial other shoe to drop to finally take action. Take action when it's small, and you're going to see yourself heal better and feel better long term. Thanks for listening today. It's been so great to talk to you. If you'd like to leave some comment in the section below, if you'd like to leave a suggestion in the section below, we'd love to hear that. We'd love to hear from you, and we look forward to talking to you again next time. In today's talk, we're going to discuss what your MD probably thinks about HBOT and why it might not matter. So stick around until the end for some simple tips on ways that you can improve your health this year. So let me give you the backstory of why this topic came to mind today. A patient who we will call Alan came in yesterday for his adjustment. At the adjustment visit, he asked me about the prices for HBOT as he wanted to do some more dives. We started talking about hyperbarics. He mentioned that he had recently asked his physician what he thought about HBOT. He said the doctor's reply was basically he hadn't thought about it. This disappointed Alan because Alan wants his doctor to do three things. He wants his doctor to think about how various things like HBOT could help his clients. Also, he wants his doctor to have informed opinion on things like HBOT. Third, he wants his doctor to not just throw another pill at his problem. Alan told me that he was told to take a higher dose of a statin drug. Instead, he is keeping the same dose of statin, but has added a supplement called nattokinase. In just 2 days of adjusting patients, Alan was the third patient to bring up a new supplement that they have added to their regime. Interestingly, it sounded like all of them are researching online what supplements are out there to help their particular concerns. Are more people currently trying out new products to fix their problems than they did in the past? That's hard for me to say, but what I can say is that those patients that are doing new things and trying out new products appear to often be getting results that they like. So what does this do with HBOT? Well, you may be like Alan and ask your MD to give you an opinion on HBOT. What I want you to know is that from what I am seeing, no matter if it is a nutritionist, a chiropractor, a physician, or what have you, most healthcare professionals appear to be poorly educated about HBOT. And I too was the same way. Also, I have seen that even where there are hyperbaric chambers in medical facilities, that the chambers appear to be underutilized. The majority of doctors do not understand how well HBOT works. Even worse, there are many healthcare quote-unquote professionals who are negative about HBOT when they should simply say, quote, I don't really understand if HBOT would help you or not, unquote. For over 3 years, we've been offering hyperbaric oxygen therapy in our clinic. It's been truly amazing to see the varied ways that clients have been helped with HBOT. I think given the chance, if your doctor would have seen what we have seen, they too would be fans. For example, my wife Jamie feels the Lyme disease symptoms that she has dealt with for over 11 years are 85% better. She swam at the University of Minnesota for 3 years, so she was a great athlete. We are seeing her athleticism blossom again. She is back working out 4 days a week. So that's one of the great things we've seen with HBOT. On a weekly basis, we're getting at least one very strong testimonial from our HBOT clients that really gets us jazzed about how HBOT is helping them. This last week, we had a patient who's about 87 years of age who started doing dives at the start of December, which is not even 2.5 months ago. Soon after starting the dives, a mass was found under his jaw during a dental appointment. He was excited to tell me last week that the cancer had already disappeared since it was found and diagnosed. He attributed the sudden disappearance to having done the HBOT dives. So when I say maybe it does not matter what your doctor thinks, I say that from the place of we all need to do our own research and follow our gut feeling or Holy Spirit, however you want to say that. If you asked me 4 years ago what I thought about HBOT, I would say that all I knew about it was it helped people with burns and decompression sickness. People that, like scuba divers that had been injured as they're diving. So I think that we're in a new era. An era where what we don't know can hurt us, but also an era where there are many new things that are being revealed to those that will take the time to learn and investigate. This year, how about considering being more inquisitive, taking more risks, and even doing some new things? Here are some ideas for you. Get a personal trainer and go 1 or 2 times per week. I've been going 2 times per week to the personal trainer for years, and what a difference it has made for me. I am 54 and I don't want to wait till I lose my strength to start exercising. And what a great way it is to de-stress when I do exercise. On a daily basis, you might consider taking a good multivitamin, fish oil, and vitamin D. If you're already doing those things, you might consider adding in trace minerals or even glutathione, a wonderful antioxidant. Do HBOT. Remember, frequency matters, which for most conditions means 3 times per week to get and keep the ball rolling. As you know, not every supplement, exercise, or therapy, including HBOT, is right for everyone. So if needed, get counsel before starting. If you have any questions or suggestions, leave those in the comments section below. Visit our website for more information. That's also in the comments section below. As always, it's been a pleasure talking to you, and I look forward to talking to you on our next video. So you injured your wrist, and now you're looking to find out what to do about it. Well, in today's talk, I'm going to talk about a few different things about a bad wrist sprain. I had one of those several years ago, and so today I'm going to talk about what my story was, what my experience was, what some of the things I learned through that experience, but also I'm going to share with you what I'd want you to know, what you can do right now about this wrist sprain, and also what you can do next steps and in future steps to do for that wrist sprain. So let's first of all talk about the wrist sprain that I experienced. So this was about 2015. I was at the gym, and there was this tall apparatus, kind of like a giant jungle gym, and there was this guy that was like a monkey. This guy could jump from one bar to the next, and I thought, well, that looks pretty cool. If he did it, I think I could do it. And I was up there doing that, and I made a leap, and it was a longer leap, and I missed the grab, and now I'm falling. Well, this thing was so tall, and I'm 6'1". This thing is so tall that when I fell a long way, but I didn't want to hit my head. So my hand went just naturally back, and I landed on that hand, jammed the wrist, jammed the elbow, I'm sure jammed my shoulder, but I didn't hit my head, which was a great thing. And I remember laying there thinking, did I hit my head? Well, it made a thud so loud that the personal trainer that owned the place came kind of like running into the room. He heard me hit that concrete. And it was padded, so it wasn't awful, but it was loud, I'm sure, for him to hear that. And I held my wrist, and I was in a lot of pain, and that was it for the workout that day. So what happened through that experience was I had a lot of pain, a lot of swelling. One of the bursa sacs in that wrist joint, one of those little cushions in there, had slipped out of place. And so this was an experience that taught me about what do you do if you have a lot of pain and a new injury. Well, one of the first things I had to do was figure out what to do for my chiropractic patients. I brought in a relief doctor. He covered my business, and fortunately he was a good adjuster, and he did a good job, and he could keep things going for us. But the next thing is I needed a plan of what to do next. I went to a orthopedic doctor, and he checked my wrist, and he took my wrist actually and twisted it from side to side. And I remember just this whole thing getting lit up. I'm not sure why he had to twist it to find out if I had pain, because I definitely knew I had pain. He could see this thing was swollen. I had so much pain. I remember being in the shower once, putting my hand on the wall, and I couldn't do this direction. I couldn't go like that without having pain. It just was lit up. It was lit up big time. I couldn't hold a pen. I had a lot of things I couldn't do, and I definitely had some fear. I had definitely had fear about this. In addition to spraining that wrist, when I got better, I ended up falling roller skating and landing on the other wrist. And now I had a brace on the other wrist. So through that whole experience, I got to learn a lot about how to heal a wrist, how to heal from what I'd call a short-term disability. So today we're going to talk about how to heal a wrist and how to deal with a short-term disability. So what did I learn from that experience? Well, I learned some things as a chiropractor, and I want to talk about those things first. First of all, healing definitely takes time. That's an adage we know. It's something that we tell our patients. It's different when you go through it yourself. Now, what I found was healing takes time. What that meant for me was, I had that other relief doctor in the office, and sometimes he'd be working on a patient doing a seated adjustment. And I'd see him do that adjustment. Maybe he's not getting the adjustment the way I thought I could get the adjustment for that patient. And so I'd want to step in there and do that adjustment. But I wasn't ready. I felt better, but I wasn't ready. And I'd light that wrist up again, and I'd set myself back in that healing time. So don't rush back too soon and re-injure yourself. You want to avoid a re-injury. One of the other things I learned about was this bursa sac had slipped out of the joint. And what I learned about is how you can actually set that back in place, how you can adjust that back in place. Further, I learned about how there's many other ways of adjusting the wrist that I never knew about. I learned about various different ways that were there, and that was exciting to learn more things, and now I've got more things in the toolbox. And I'm going to talk to you about how you can get those for yourself, and we'll talk about how to find the chiropractor that can do those for you. But there's various things I learned through that healing process. I had a lot of pain. In fact, I had so much pain I had a Vicodin prescription. It was up there in the cabinet, but I didn't want to touch it. I didn't want to take that narcotic. So we used a combination of essential oils, and if you Google morphine balm, this is what the essential oils were: frankincense, balsam fir, and copaiba. And I put those in a double O capsule, and I took those, and I was amazed to see how that helped me with the pain level. So now I had some help with the pain, and it didn't give me brain fog, and I knew it was going to be anti-inflammatory. It was a good thing. I don't like the name of it so much, but if you Google it, you'll see that online. One of the other things I learned was if you've severely sprained your wrist or a bigger sprain on the wrist, I recommend you'd wear a brace at night. What I saw happening was at night, sometimes that wrist can get turned in or tipped in like this, flexed. And so by wearing a brace, you're going to keep it more of a neutral position and not jack it up as you're sleeping like this. So wearing a wrist brace is a good thing. So if you called me today and you said, listen, I sprained my wrist just like you did, what do I need to do about this? Here's some of the things that I would do if I was you. First of all, I would get into a good chiropractic office as soon as possible. It's said to be a golden 2 hours where in 2 hours you can, if you get adjusted, it's going to help you avoid that inflammation setting in as much. It's going to help you reestablish your alignment better. We need to check your wrist. If we can adjust your wrist, it'd be good to have your wrist adjusted. It'd also be good to have your neck and your spine adjusted because the nerves from your neck and spine innervate into the hand. In fact, we're looking at anything from C1 down to T4, typically going into the hand, and sometimes we've had numbness in the hand in the areas of T6 and T7. T means thoracic part of the vertebrae. C is for cervical. So we want to check the innervation into that hand, into the wrist. We want to look at the alignment of that area. The other thing I would look at is I would get into a hyperbaric chamber as quickly as I can. When I sprained this shoulder back in September, I was in that chamber within an hour, and it really made a difference for me. At that time, I had very little mobility in that shoulder, but I got in there right away, and I think that really helped me heal faster. So looking at hyperbaric oxygen therapy for this issue also would be a good thing. Some other things I would look at would be cold laser therapy, kinesiotaping. Maybe if you've got PEMF, pulse electromagnetic frequency, where they can help heal that tissue. I used that on that shoulder back in September. So those are some of the therapies. Nutritionally, avoiding foods that inflame you, bad fats, sugars, flours. Those are ways to deflame yourself from your diet. Further, I would look at taking some natural anti-inflammatories like turmeric or bromelain. Those are some things I'd look at nutritionally and things in your diet. In addition to that, you might look at prayer, watching encouraging sermons. I remember one day when I had sprained this wrist and I just was so frustrated with myself, frustrated with what was going on. I couldn't produce, I couldn't help my patients. I could talk, but I couldn't adjust, and that's not a good thing it's not a good look for a chiropractor. So I went home and I remember watching the sermon. This gal had dealt with cancer and talked about her story and things she did, and it really encouraged me to see, even though she needed like a surgery and that there was success that she had through that whole process, and it encouraged me to know even bigger issues can be healed, and it just gave me hope. And I think it's important to keep yourself hopeful and not hopeless. Now what I do as far as keeping myself hopeful, I'd watch encouraging sermons. I'd watch those ministers that make you feel good and not feel hopeless. And so you gotta pick and choose who you're gonna listen to on that. So I just Googled, what is the strongest predictor for return to work after injury? It says level of depressive symptoms. Further, in a physically injured population receiving workers' compensation benefits who are judged to be not clearly permanently disabled, level of depressive symptoms is a strong predictor of returning to work. So what this means is your headspace is going to change and affect your ability to get back to that workspace. We need to be able to have a good headspace to make sure we're healing properly. Watch the words you're saying. When I injured this wrist, one of the great things about my wife is she never said, what if? And she never said, what if you never can get back to work again? What if you never can heal this injury again? You've got that clinic over there. You've got that business over there. We've got 3 kids to take care of. She never said, what if? And I think it's important to make sure that you're keeping your headspace clean. And one of the ways to do that is watch for ways that you're progressing. Watch for ways that you're improving. One of the things I've also heard about is that injured workers that feel that their co-workers care about them, are more successful in coming back to work. Now that's an interesting point because, you know, a lot of times when we work a job, do we really think about if our coworkers care about us? Now, I don't know how to change how our coworkers can care about us other than maybe change where you're working, but it's important to make sure that we're taking care of ourselves, making sure that we're thinking well of ourselves, and that we're also keeping a good expectation on that healing process. What do you do if you're in a short-term disability? Well, we just had somebody come in that was on light duty, and she was having quite a bit of pain in her knee. She had fallen, she had an injury on the knee, and her job did not have any light duty work. So she was off on light duty for a whole month. She came to see me, and her kneecap was slid up just a little bit. You could see it on the x-ray, slid up out of place. We put that kneecap back in place, and she instantly had relief. And within 1 week, she was back working, no longer on light duty, and she's since sent in 2 or 3 patients. She's so happy that she's feeling better. She's able to work. You know, this is not a good thing when you can't work. It's not like people are making a lot of money on workers' compensation disability. Maybe they're getting 60%. I'm not sure exactly what they're getting, but they're not getting their full income. And so we need to get back to work. We need to get back work quickly. And to do that, if somebody's on short-term disability or light duty, I recommend getting with a good chiropractor. I do the Gonstead system, and in that system, we're analytical. We are specific in what we're doing. We're discerning of what we're doing. We want to use different tools. We've got x-rays up. We've got an instrument called a temposcope or nervoscope, different temperature sensing device to look for a pinched nerve. And so this analytical process that we do allows us to give more specific, properly placed adjustments. Now, can I say everyone that claims to do the Gonstead system is a wonderful chiropractor? I'm not saying that. So you need to have some due diligence in that process of selecting. The other thing to know is not every chiropractor is going to know everything about, let's say, that specific injury. So maybe you've got to check out a couple chiropractors to know who's going to know how to not just adjust the spine, but adjust that extremity, adjust that elbow, or adjust that wrist. The other thing that we talked about is using hyperbaric oxygen therapy. Now there's different types of hyperbaric oxygen therapy. There's mild pressure, and there's more of regular hyperbaric oxygen therapy, which would be in a hard-sided chamber. With these injuries that we're talking about, where people are out of work and have lost time, a soft chamber might work for them, and maybe they just need more time. But maybe they've had a bigger injury. Maybe it's been months and months since they've been working, or since they stopped working, and they need to get in a hard-sided chamber. And that hard-sided chamber's got more power to it, and it can get us to deeper pressures. Typically about 33 feet down is the pressure to deal with inflammation. So in a soft chamber, you're about 10 feet down, you're dealing with inflammation. So soft chamber, hard chamber, whatever one you've got access to, I'd recommend. So those are a couple different ideas for you today. If you have any comments or questions, leave those in the section below. We're so glad to be able to talk with you today. It's been a great pleasure to share this information with you, and wish you the very best on, if you're dealing with an injury, on a quick and speedy and full recovery. Have you ever thought about doing hyperbaric oxygen therapy but didn't know where to start? In this short video, we're going to talk about hyperbaric oxygen therapy, or HBOT for short. We'll cover what HBOT is, the 2 main effects that it has, some of the conditions that it affects, and also 3 different ways that you can experience hyperbaric oxygen therapy. First, what is HBOT? Hyperbaric oxygen therapy is where a patient goes in a pressurized chamber where they breathe air or varying amounts of oxygen, where the pressure is anywhere above 1 atmosphere. A British physician named Henshaw first used hyperbaric oxygen therapy in 1662 as a medical therapy. During the 1960s, studies started to show many beneficial uses of hyperbarics. Since that time, multitudes of people have found hyperbarics to be both beneficial and effective. As you can imagine, increased oxygen has a positive effect on the body, but do you know that increased pressure can also have a positive effect on the body? Both were found to turn on or turn off genes. If I was going to tell you one thing about hyperbaric oxygen therapy that you'd remember today, it's this. HBOT decreases inflammation and it also decreases swelling. Increased inflammation and swelling are seen with most diseases and wounds. So anytime you have decreased inflammation or decreased swelling, it's a great thing. In addition to decreasing swelling and decreasing inflammation, there's many other ways that hyperbaric oxygen therapy helps heal the body. We'll talk about those other ways on various future videos on YouTube. Let's now discuss what conditions can be helped with HBOT. There are both traditional indications and non-traditional indications. The traditional indications are 15 approved conditions that Medicare covers. Every one of those Medicare approved conditions are a different type of wound. And those wounds can vary from flesh-eating wound to carbon monoxide poisoning. It could be a crush injury. So a lot of times they're just pretty much a list of nasty wounds. Could be a burn. These conditions are frequently seen in a hospital setting. Globally, 130 conditions are collectively approved by various countries. The amount of research supporting the use of hyperbaric oxygen therapy is amazing. The non-traditional indications are conditions, while not covered by Medicare, are still helped by HBOT. Some examples include anti-aging, autism, long COVID, post-stroke, and traumatic brain injury. Other conditions include dementia, post-surgical, Lyme disease, mold toxicity, and PTSD. The list of non-traditional indications is a long list and too long to actually mention right now. HBOT is done in a hyperbaric chamber. There's mild hyperbarics, which is done in a soft-sided chamber, and there's hyperbaric oxygen therapy, which is done in a hard-sided chamber. The soft chamber has one setting, 1.3 atmospheres. What's an atmosphere? Well, if you're at sea level, the weight of 60,000 feet of air above you creates 1 atmosphere of pressure. The hard-sided chamber can be at 1.3 atmospheres. It can be as high in our clinic as 2.8 atmospheres. Most patients in our hard chamber are anywhere from 1.5 to 2.4 atmospheres. Each of these different pressure levels allows us to give a different dosage for what the patient needs. Now, in a soft-sided chamber, you don't have as much pressure, but it's often said that you can make up in time what you don't have in pressure. So we can have more sessions, let's say, in a soft chamber and make up what we don't have in that higher pressure in the hard chamber. So these are two different ways that you can experience hyperbaric oxygen therapy in our office. You can go in the soft chamber, you can go in the hard chamber. We have a third way that you can experience hyperbaric oxygen therapy, and that's our rental chamber. And that's a soft chamber that again goes to 1.3 atmospheres, and we set that up for your home use so that you can use this for your home. We actually had this in a house recently, this earlier this year, where an 18-month-old girl had a concussion, and now they're 2 hours and 15 minutes from our clinic, so it was not going to be convenient to drive up to the office for a session, what we call a dive in the clinic. So we brought that rental chamber to their house, we set it up, and they had that chamber in their house for 2 months. And by the end of it, that little girl now she's 20 months old, and she was at 80% improvement. So they were really happy with that. It was a great progress that they saw. I hope this video has helped you learn more about why you should do hyperbaric oxygen therapy. Hey, and if you want to know more about DeLorey Chiropractic, check our website, which is listed in the description below. If you have any questions about the topics we talked about today, you can leave those in the comments. If you have any suggestions on future topics that you'd like to hear covered, please also, you can put those in the comments. As always, it's been a pleasure to talk to you today. We look forward to talking to you again next time. Have you ever wondered how many sessions of hyperbaric oxygen therapy you would need? In this short video, we're going to cover how many sessions of HBOT you would need depending on the outcome that you're looking to achieve or the illness or injury that you're looking to address. Our first step is to get a thorough history of you, and that allows us to understand what's going on and what we need to address, and frankly, what do you want to accomplish? Our focus is accomplishing your goals, your outcomes. So without knowing your history, I'm going to talk today about using some rules of thumb for care with hyperbaric oxygen therapy. First, let's talk about the gold standard for HBOT, which is 40 sessions, or what we call dives. These dives are done at a frequency of 3 to 5 days per week, with 3 dives per week as a minimum. In our clinic, we typically recommend 3 dives per week, which are spaced out over the week for most divers. As we're healing at the cell level, this frequency allows us to build momentum in our healing. First, let's talk about the gold standard for hyperbaric oxygen therapy. The gold standard for HBOT is 40 sessions of hyperbaric oxygen therapy dives. And the reason it's 40 is that over time, clinics found that was enough care to get the desired result for most conditions. How often do you need to come in to achieve those 40 sessions? Well, it could be daily, 5 days a week, or it could be 3 times a week. We find that 3 times a week is a good minimum frequency to achieve the goals that you want to accomplish. This allows us to see you on a Monday, a Wednesday, a Friday, so that you're getting momentum week by week. And because you're healing at the cell level, we need to build momentum. So next, the number of sessions needed varies based on the indication that's being addressed. An indication is a specific medical condition or situation that HBOT has a benefit in helping. Based on the recommended protocols, the number of sessions needed could be as few as 3 sessions for someone dealing with acute carbon monoxide poisoning, or even 90 sessions for somebody dealing with diabetes. There are 3 main reasons that a person could need more sessions to address the same condition than another person. How severe their condition is, what complicating factors are they dealing with, and what are they actually putting in their body? What kind of inputs are they actually putting into their body, and those inputs can affect how they heal. For example, some of those complicating factors could be obesity, could be diet, could be are you hydrated, how much water you're drinking, could be how much sleep you're getting. So there's many different complicating factors, and so by the person, each of those complicating factors can slow down your healing, and it's important to think about those as we're working to achieve your goal of healing from this condition. Another key factor in knowing how many dives that you will need depends on which pressure that you're diving at. It is said that you can often make up in time what you don't have in pressure. This means that if you do your dives in a soft chamber, that could take more sessions than if you do your dives in a hard chamber at a higher pressure. When we started with hyperbaric oxygen therapy, we only had soft chambers. And when I say only, that's not really stating how much positive effect we had with those chambers. But we didn't have a hard chamber. And we knew in some of these cases we would need a hard chamber to really crack the code and address the specific person's needs. So for example, we're dealing with patients that had cancer. And the protocols for people dealing with cancer are anywhere from 2 to 2.4 atmospheres. And so to help those people heal better, to get them beyond the 1.3 atmospheres that we're at, we wanted that tool with the hard chamber. And so we got a hard chamber that allows us to go up to 2.4, even 2.8 atmospheres. Most of the time, the pressure in that chamber is 1.5 to 2.4 atmospheres. Now, certain conditions like neurologic issues, they heal best between 1.5 and 1.75 atmospheres. That range can vary from 1.3 to even 2 atmospheres, but there's a sweet spot between 1.5 and 1.75 for most neurologic conditions. Now, as we've said before, you can often make up in time what you don't have in pressure. That soft chamber, where it's at 1.3 atmospheres, can often get the job done for someone, let's say, has a concussion, but it would take more time. But let's say we had plateaued and we're not really getting the job done with that soft chamber. Well, by going in the hard chamber, we got a chance to crack the code, to get them the right pressure, the right dosage of pressure that they need. So another question that people ask is, will I need to keep coming back for more hyperbaric oxygen therapy? You know, it really depends on a couple things. It depends, first of all, what condition are we addressing? If we're addressing somebody with Parkinson's, where there's been a injury that's hard to repair or correct, for those people, ongoing maintenance dosage of hyperbaric oxygen therapy, let's say in a soft chamber in a home setting, is a great thing. For other people, let's say it's their first concussion, and we can address the issue and get them to pre-injury status. For those people, I'm not necessarily seeing that they need to come back for more care once they've achieved their desired results. So it depends case by case on should you come back for more care. One of our patients had 3 major head injuries, and one of those times she cracked her skull. She actually comes in on a monthly basis. Why is that? Because she knows it's allowing her to help maintain that level of success that she's had through the prior dives. So some people need maybe weekly care. Some people might need once a month. Some people that, let's say that person with Parkinson's, maybe they need to be doing 3 times a week. So all is going to depend on your specific case and your specific needs. If you have any questions about our discussion today, you can leave those in the comments section below. To learn more about our clinic, you can check out our website, which is listed in the description section below. As always, it's been a great pleasure to talk to you. We look forward to talking to you on our next video. Are you an athlete that wants to perform better? Would you like to heal faster from sports injuries? Would you like to decrease the chance of re-injury? If you answered yes to any of these questions, stick with me until the end of this video to learn how HBOT helps you heal faster. But before we get into the details about all the great ways that HBOT can help your athletic performance, I want to share a fun fact about horse racing. Did you know that according to the American Association of Equine Practitioners Guidelines, HBOT is prohibited within 4 days of a horse race? The reason given is that HBOT is considered performance enhancing. So let that sink in for a minute. The horses were given oxygen in a pressurized environment for as little as 30-minute treatments, and now they were banned from the race because they were unnaturally performing in too good of a way. Now, I am not for cheating, but I am for performing in a great, even excellent way. With that said, let's talk about 5 ways HBOT can enhance your performance. Number 1, HBOT decreases inflammation. That's always a good thing. Number 2, HBOT improves mitochondrial function. This means that you will have more energy since the mitochondria are the powerhouse of the cell. Number 3, HBOT improves VO2 max, or maximal oxygen consumption. This refers to the maximum amount of oxygen that someone can utilize during intense or maximal exercise. This measurement is generally considered the best indicator of cardiovascular fitness and aerobic endurance. A 2022 study by Hadani found that HBOT enhanced VO2 max physical performance in healthy, middle-aged master athletes. Number 4, HBOT improves muscle recovery by decreasing lactic acid. Number 5, HBOT improves several aspects of brain activity, including an improvement in cerebral blood flow, brain metabolism, and brain microstructure. And this leads to improvement in cognitive functions, sleep, and gait, leading to an overall improved performance. Elite athletes are naturally enhancing their endurance, recovery, and strength and performance with HBOT. While you may not be an elite level athlete, now you too can improve your athletic performance by incorporating HBOT into your weekly routine. I promise to share with you how HBOT helps you heal faster. I recently fell hard and hurt this left shoulder. I had fallen out of bed, landed on an outstretched arm, and had intense pain. Everyone in the lower part of the house, the family, they knew something happened. They could hear me fall and hit the floor. And by the time I came down to the lower level, first floor of the house, I had just a very high amount of pain, and not sure what I did, but I was really concerned about it. Well, I ended up driving over to our clinic, getting in the hyperbaric chamber. It was about 1 a.m., but on the drive over, still had so much pain, I was considering, should I just bypass the clinic and go right to the emergency room? Well, I skipped the emergency room, went in the hyperbaric chamber, had a good dive, and that week was going to my chiropractor, still having a lot of restriction, and still couldn't lift my arm beyond this point. Ended up having my chiropractor tell me he thought I should get an MRI. He thought the injury was that bad. Well, I ended up getting more adjustments, more hyperbaric oxygen therapy, did some cold laser therapy, some kinesiotaping on it, and what's been amazing to see is how quickly this shoulder healed. And I think a big part of that was getting in that hyperbaric chamber in a short time after that injury. So talking about how hyperbaric oxygen therapy can help injuries, there's a great study by Botha et al. In 2015 about how 42 rugby players healed hamstring injuries faster and had less hamstring re-injuries. In this study, they talked about two kinds of hamstring injuries. A grade 1 hamstring tear or strain, which is described as tightness in the muscle while stretching, inability to fully move your leg while bending or straightened, and inability to bear weight on the leg affected. Or a grade 2 hamstring tear or strain, which is described as reduced muscular strength, limping when walking, and pain when bending the knee. The exciting part of this study from Botha et al. Read, quote, a significant decrease in the injury time of the hamstring injuries in rugby players was noted, with a 38% reduction in injury time in players with a grade 1 injury, and 45.7% reduction in players with a grade 2 injury. In terms of recurrent injuries, this means the injury happened again. 62% of players with a grade 1 injury remained uninjured after treatment. And the percentage for re-injured players with grade 2 hamstring injuries was 0% after HBOT, PRP, and physical therapy treatment. PRP is plasma-rich protein. In this study, they found that the average healing time was decreased by 13 days from the norm of 21 days for the grade 1 hamstring injuries and decreased by 23 days from the norm of 42 days for the grade 2 hamstring injuries. HBOT has many benefits in healing the body, including the following: stem cell mobilization, mitochondrial enhancement, inflammation control, decreased swelling, neuroplastic repair of the brain, helping heal concussions, accelerated soft tissue healing. Isn't that amazing? In conclusion, we've talked about 5 ways that HBOT helps athletic performance. We also addressed 6 ways that HBOT helps heal sports injuries. I hope that this information will help you be better prepared to perform your favorite sport at a higher level. If you have any questions, please feel free to leave those in the comments section below. Also, if you have any suggestions for future topics, you can leave those in the comments section below. To learn more about our clinic, see our website listed in our description below. As always, it's been a pleasure to talk to you. I look forward to talking to you on our next video. Well, Mary, thanks for joining me today.
You're welcome.
Again, this is Dr. Nathan DeLorey. I'm with Mary, and she's going to share testimonials of things she's seen with hyperbaric oxygen therapy. So bring us back to when you first came in and tell us what brought you into our clinic.
Well, my name is Mary Gilson, and I've been coming here a little over 2 years. A friend literally threw a book at me that she got from your office about hyperbaric oxygen. And I read the first chapter and called the office and said, when can I get in? And within a couple hours, I was here meeting with you, watching a video, taking the tour. And right after that, I took my first dive. And by that time, it was after hours on a Friday. And I was a new client, and you stayed. And I've never forgotten that. That speaks a lot to how much people care here.
Awesome, awesome. Thank you. So you came in, and what was going on for you at that time?
I was pretty much a hot mess. I could barely walk. I couldn't lift my feet. I shuffled down the hallway to the tank, and you'd help. I call it the tank. I'm sorry, it's the chamber. Shuffled down the hallway to the chamber, and you'd help me inside and checked on me frequently. And there's windows and walkie-talkies, and so it was very comfortable in this nice, cushy, big chair. And when I got out, I popped out of the chair and stood up and looked around like, what just happened? And I pretty much sprinted down the hallway. And I think the only question I asked you is, can I hug you now? Which I did. Then I took another walk and I gave you another hug. And it was unbelievable. I couldn't believe it. I said, I wish we would have had a video of me walking in compared to walking out. So that's how I started.
So you had some problems for a while before you came in. And what were some of those issues going on?
Just a lot of mobility issues and breathing issues, and none of my various doctors that I've been to could figure it out until I came here.
So Mary, when you first came in, I remember you'd had some chronic issues for about 3 years, and I remember that there's a cane. I remember that when you came up from that first session in the chamber,
you now were holding your cane in your hand.
Horizontally, as I recall.
Yep, and you're standing upright, and so it was amazing change that we saw in that first visit. We went outside, and you wanted to walk, and you hadn't been able to walk really for a while.
Yeah, we made a couple laps in the parking lot, as I recall.
So you were able to walk, but you weren't able to walk for that length of time.
Yeah.
So really, what an amazing change we saw that first session. What did you see over time with the dives? What have you seen?
I've been coming twice a week, and I schedule my life around my sessions here. So if I know I'm coming on Monday morning, Monday afternoon, I know I'll have the energy to do laundry or vacuum or get groceries. Before I was doing hyperbarics, I was taking 3 naps a day, and I was still exhausted. I would wake up in the morning and think, when can I get a nap? I'd take a nap, have lunch. No, when's my afternoon nap going to be? And I'd barely make it through dinner and be falling asleep at the kitchen table. And now I don't nap at all. When I first started, I would fall asleep in the chamber, and now I don't. I'm saying my prayers and reading a book, and it's amazing, the difference. So I schedule my life around it.
Have you always come in twice a week? Did you come in more often initially?
There were a couple times where I came in 3 times a week. I think probably after I had pneumonia, and I couldn't wait to get out of the hospital and get back in the chamber. And after that first time, it was like, oh my gosh, I can breathe again. Because after you've had pneumonia, your lungs are just not good.
Mm-hmm.
So I think overall, I average twice a week.
Okay.
And that works for me.
Okay. And what other things have you seen with hyperbaric?
I think, as I explain it to people, it's not just the physical, it's also the mental aspect of it. When I get out of the chamber, if I've been stressed out about something on the way in or upset about something, I get out and I'm calmer. I'm energized. I can't wait to go home and do stuff, but I'm calm. It's just hard to put into words.
Those are great changes. Now, we were talking before we were doing the video about your dog Justice, and do you want to tell me about things you saw for your dog?
He's now a 14-year-old Shih Tzu. Last July, he had malignant melanoma in his mouth, great big nasty tumor sticking out of his mouth. The vet took out a tumor, took out 6 teeth, and he healed up, and 2 months later, it started growing back again. And brought him back to the vet, and they said, well, there's really nothing else we can do. Here's some pain meds, keep him comfortable, good luck. And I love my vet, but that's all they could do. So I talked to you, I said, what do you think? So we put him in the chamber the first time, and we were all a little nervous because we didn't know how he'd react.
Yeah.
He fell asleep right away. He crawled up on my lap, put his head down, and fell asleep. And over the next 2 weeks, that ugly tumor reduced, and it's gone. And we took pictures of him every single day and brought him back to the vet a month after we started, and they couldn't believe it. And every vet in the building had to come in the little room and say, oh my gosh, what did you do? And that was last September, and it has not come back.
That's amazing.
So.
And then this weekend, you said he had some diarrhea issues.
Yes, we're going to talk about diarrhea, huh? Yes, he had unexplained explosive diarrhea middle of the night, Saturday night, and didn't eat much on Saturday, didn't eat anything on Sunday. I thought, oh boy, should I even bring him to my hyperbarics on Monday morning? What am I going to do in the chamber with a dog with diarrhea? It didn't sound like a good plan, but he was fine. He hadn't done anything since early Sunday morning. So I brought him in, and he curled up like he always does, and I bring my other dog with me too. She had a little cough, and I started bringing her, and she doesn't cough anymore, so might as well if you're going to bring one dog, you might as well bring 2. And after we got home, he walked right in the house and immediately wanted to eat. And he hadn't eaten in 2 days. So it was just amazing how whatever little bug he had, that cured. I remember talking to you early on this, and I said, I used to have these digestive issues, and you very nonchalantly said, oh yeah, hyperbarics will fix that too. I'm like, oh my gosh, you're fixing problems I didn't know I was here to fix. So that it was amazing.
Wow, that is amazing. That is amazing. One of the things that's been amazing with you is how you've motivated many people to come in and get hyperbaric oxygen therapy. And so if you were going to talk to the audience and let them know what are 1 or 2 reasons that they should consider hyperbaric oxygen therapy?
Yeah, like I said, I've referred so many friends here and they've all had great results. Just have an open mind and try it. There's no reason not to. It's not like you're trying a new experimental drug that's going to cause side effects or cause another problem so you need another medication. It's nothing like that, because we all know that happens. It's comfortable, it's easy. The results are incredible. I think you've said I'm kind of the anomaly that I got such a burst after the first one, and it takes a little bit longer, and you have to keep at it. You have to not go once and go, well, I didn't feel that. You have to keep coming, so you have to have a little patience. But there's no reason not to try it, especially if you've got chronic problems and no one else fixing it. This is a good thing to try. Like I said, it's so comfortable and so relaxing when you're in a session. It's not at all, people ask me, aren't you claustrophobic? I could never do that. It's not at all like going in an MRI or something like that. The chambers are big. You can have 2 people in them. You can move around. It's not at all confining. Then they check on you constantly. So it's very comfortable. It's very easy, and you get great results. So why not? That's how I tell my friends. Why not? Try it.
Sure. Awesome. Well, thank you, Mary, so much for taking the time to share your experience and your feedback about hyperbaric oxygen therapy.
My pleasure.
Yeah, thank you so much. Appreciate you, Mary.
Thank you. Appreciate you.
Hi, my name is Dr. Nathan DeLorey, and today's talk we're going to talk, instead of going into the depths of hyperbaric's facts and research, I want to talk more about my personal story about why I got into hyperbaric oxygen therapy and why I'm excited about using that service for our clients. So today I'm going to be getting some questions from our friend Chris in the office, and I'm excited because he hasn't told me all of his questions. He's got a surprise question, so make sure you stay to the end of the video for when Chris is giving me the surprise question. Now, is it going to be the last question? I'm not sure. He's not telling me when he's giving me that surprise question. So, Chris, I'm all ears. What do you got for me?
So, thank you for having me here today. But the very first question is actually something that you brought up immediately, and that would be, how did you actually get into HBOT? How did you learn about it? Why did you commit to it? So on and so forth. You know, what brought you in?
What happened was my best friend, Dr. Dana Landon in Elgin, he got to see the results of what hyperbaric oxygen therapy can do for his wife. His wife had been dealing with long COVID. She had a lot of fatigue. One day he came home and she's laying on the floor between the bathroom and the adjoining bedroom. She couldn't get from the bathroom back to the bedroom. So she really had a lot of issues with this long COVID. And they got her to a chamber, and they did 3 sessions one week and 3 sessions another week. Then they flew to the Carolinas. She walked 2 miles down that beach, and it was a windy day, the sand's blowing around. And then she said, well, how far did I walk? And they walked 2 miles back, and she really had a big change with the amount of energy that she had. She's a flight attendant, so she was already a little bit primed to receive that increased oxygen. You know, when you fly, you're at about 16% oxygen, and typically we got 21% oxygen in the air. So she's used to this hypoxic environment, and so they saw some exciting things with this long COVID symptom for her. They ended up buying a chamber. They saw wonderful things happening. I got to go meet some of these people. One gentleman had long COVID with memory loss, and he had quit his job but was now training his son to do the job. He at 13 sessions in, his son said, listen, Dad, your memory's back. You're back. So I got to talk to him. He ends up not quitting that job. He ends up staying in that job. Another gal that was at this clinic was stuttering and having problems communicating, and her sister said, you should go in the chamber. Now this woman was dealing with Parkinson's, and she did 3 sessions one week, 3 sessions another week, and after those 2 weeks she stopped stuttering. And I got to talk to all these different people and find out, these 3 different people, and find out their testimonial. So does it fix Parkinson's in 2 weeks or long COVID in 13 sessions? I'm not saying it does that, but I got to see results for people. And as a chiropractor for over 25 years, it was exciting for me to see results for conditions that I never saw get results with chiropractic. I saw a lot of things happen with chiropractic, but long COVID affecting fatigue, or long COVID affecting memory, or people stuttering, due to their Parkinson's. I never saw results with chiropractic changing those kind of conditions, and now they were getting changes that were obvious. So that's how I got into it, and I then, well, I got exposed to it. I then took a class, 40-hour class, got additional training, and then we took the jump into the water, if you will, and bought a chamber and started seeing patients have their own testimonials in our clinic.
That's awesome, to say the very least. You're seeing a lot of different changes in people around you. It's benefiting others. You actually did the footwork, and what's scary sometimes with medical is you got to make sure that you know everything. You're reading studies, you're taking classes like you did, and you did all that footwork. And while you've told me a lot about the people that have come to the clinic or people that you've generally met, I want to hear more about you. What about HBOT has benefited, let's say, you personally in your personal life, your family? I've heard stories about your wife even. So
Yeah.
What about what's going on there?
So on the personal side, what's been exciting to see is I've been able to see myself, my wife, our three children, my dad, his wife, all these different people in my family that I love and I care about get help with hyperbaric oxygen therapy. I've been able to see back pain make changes that I never saw as far as speed. I saw some changes with the right sacroiliac joint pain. I got to see my wife make progress that's been amazing with Lyme disease. At this point, she's 85% better. And this is a condition that she's had for 11 years. And for her to feel 85% better, it's been amazing for us. I've been able to see my dad golf better and have more vitality. And so it's been exciting to see the wellness side as well as the longevity side for my dad.
What I find interesting actually is when you mentioned like the 85% better and all that stuff, what does that even look like? What are we simply walking better? Are we waking up with more energy? What's the day-to-day life like? Because some people might hear 85% and we all get different visualizations in our head. What is 85% to you and your family?
The 85% better means my wife is a lot more comfortable and she's a lot happier with how her body feels. Years ago when the kids were small and they would just inadvertently bump into her, it would really cause her a lot of pain. So she had a lot of sensitivity to pain. She had just a lot of issues that were surprising. Things like mood or fatigue. And so this Lyme disease is really a nasty thing. And so for her to feel 85% better, and we're believing she's trending for 100% better, what I'm seeing is my wife is encouraged. She's living her life. She's doing what she wants to do, and she's feeling comfortable. So that's an awesome thing.
You always have to love that when it comes to your significant others or the people that you love in your life. That just can't be beat, especially when you have been able to spend this time to help those people. And speaking of helping people, I actually want to lean into, I know we said that we weren't really going to talk about the facts of HBOT and stuff like that, but I want to know, in terms of, let's say, I know this isn't 100% in stone or anything like that, but what have you learned recently that you're excited about for the future of HBOT, even if it's a small study here or there that is starting to get sparked up, whatever it might be,
Well, I think the thing I'm most excited by is the longevity piece. Is to see that there's a tool that we can use that's going to change how we age, and I want to live a long time, and I want my family to all live a long time, but not just live a long time, but to be well, to be healthy, to feel good, and through chiropractic care, what we've seen is ways to feel good and many times avoid needing medications, and so that's been great, but at a gene level and a cell level, hyperbaric oxygen therapy is changing how people are aging. One of the things that's being seen is what's called the telomere length. Now the telomere are like little caps on the end of your shoelaces. And these are indicators of how aging is happening to a person's DNA. So the DNA has a look like this. The telomere is going on the end of those strands of DNA. And what they're seeing is lengthening of the telomere as people are doing hyperbaric oxygen therapy. We're also seeing stem cell increase. We're seeing the mitochondria, which is the energy producing part of the cell, being more robust, or even more of those produced inside the cell. So that means you can produce more energy. Well, if you can produce more energy in the cell, that means you can repair better, you can communicate better, your cells that is, and you can also have a stronger immune system. So all those are things that we want to have: stronger immune system, better aging, less aging, and so it's very exciting.
So with this longevity and with the body and even partially the mind, based on some of what you've said, improving when it comes to a lot of this, and the overall health or fullness of life from being able to be assisted through a lot of this. The question that I actually want to ask now is, you mentioned chiropractic. You've been in this for 25 years. Personally, we have talked about your mentor, and I want to know, how would your mentor feel about HBOT overall? And then from there, what do you think that they could see? If you would put yourself in their shoes again, you were under them for quite some time. Tell us, what do you think they would feel and think about all of HBOT and what it could do?
Sure, and that's a great question. I had really two wonderful mentors, and one was named Dr. John Thatcher, and the other one was Dr. Alex Cox. And what I see that I think they could have benefited from was, one had a stroke, and it's really affected his ability to communicate, to function. And so I think if he could see the benefit of using hyperbaric oxygen therapy to turn on the idling part of the brain, the angiogenesis function of hyperbaric, which is to increase the formation of blood vessels, creating little bypasses around areas that have been injured in the brain, I think that they could have functioned better, and I think that would have been exciting for him. My first mentor had cancer, and I believe that the hyperbaric could have helped him be potentially healthier longer dealing with that cancer. And we've seen wonderful things with patients where the hyperbarics help them have a more robust immune system. Cancer likes a hypoxic environment, and so when you flood that cancer region with oxygen, it downregulates. That's what the research says. It downregulates those cancer cells. So I think they would see that the hyperbaric oxygen therapy really dovetails very well with chiropractic. You're using oxygen and pressure to help heal the body, along with chiropractic, which is taking the interference away from the nervous system. So you're just allowing the body a further way to heal and work better.
So you've mentioned just about every single part of the body, directly, indirectly at this point. You've talked about cancer, you've talked about mitochondria, you've talked about pain in the head, the neck, the body overall. So what this leads me to is just a really short question, actually, which is, you are learning so much while still helping people. How often do some of these studies just kind of come out, these published studies that you're reading and learning from and using to continue to improve your own self?
Wow, that's a great question. I'm not sure how often the studies are coming out. I will tell you that I've been amazed to see that some conditions, like idiopathic sensorineural hearing loss, they have over 800 studies on that one condition. So the amount of studies that are out there is extensive. And so with so many studies being done, what's exciting is to see what's coming next. What's interesting about the studies, though, is it's often about a 20-year time period between when a study is released and when it's applied into healthcare. And so as consumers of healthcare, which you and I both are, it's really important to think about how we can get this information and that's been found to be true and apply it to our healthcare now instead of waiting for 20 years. So we want to not just get the research done, but we want to know how to apply it.
That makes me, as well, another consumer of healthcare my entire life, a lot more comfortable overall. And I'm learning a lot today. And I think I just have one real final question for you. And it's funny that I use the word real because this is going to go into pure, I'm not going to say pure fantasy, but if you, our doctor, could pick one thing to just magically improve about hyperbaric oxygen therapy that could improve the care that people receive from it, even if it's a little bit out there, maybe if there's no studies, doesn't matter. If you could pick one thing that could just be improved, what would that be?
I think the one thing I would look at is that there are hyperbaric chambers around this country, and many of these chambers are being underutilized. What we're seeing is for example, hospital systems that patients have. We had a patient that had a burn, extensive burns, and the patient was told that they were not a candidate for hyperbaric oxygen therapy, even though 6 months after the burn they still had open wounds. Well, when you look at people like Jay Leno and Michael Jackson, Richard Pryor, they all went in a hyperbaric chamber for burns. So what's happening is there's a gap between what hyperbaric oxygen therapy can do and what people's understanding of what it can do. So people think they know what it does, but they don't really know what it does. And I'm still learning what it does, and that's going to continue to improve. So what I'd like to see happen is more actual knowledge and utilization of that tool. And I think one of the things happening is sometimes the paradigms of how we do healthcare are limiting using these more cutting edge technologies.
Perfect. Well, Doctor, is there anything else that you'd like to say as we sign off then with our little interview?
Well, I want to thank you for listening today. It's been a great pleasure to talk to you. If you got any suggestions for comments or future ideas, you can leave those in the comments section below. Also, you can see in the description our URL for our clinic. We love meeting with you today. It's been a great pleasure. Look forward to talking with you again soon.